Good morning. I'm Pat Living with the Department of Health and Social Services and your moderator for the COVID-19 update for Wednesday, June 9th. We are joined today by the Minister of Health and Social Services, the Honourable Tracy-Anne McPhee, and the Yukon's Chief Medical Officer of Health, Dr. Brennan Hanley. Our sign language interpretation is provided by Mary Thiessen and our French translation by André Boursier from the French Language Services Directorate. Following our speakers, we will go to the phone lines for questions from reporters. We will call you by name and you will each have 2 questions. Minister McPhee.
Thanks, Pat. Sorry. Good morning, everyone. I'm happy to be here with Dr. Hanley on the traditional territory of the Kwanlin First Nation and the Ta'an Quechan Council. I'd like to thank everyone for listening in today and for tuning into this update. Before I start, I'd like to take a moment on behalf of our government and all Yukoners to express our condolences to the people of London, Ontario, as well as the Muslim communities throughout Canada. We are all devastated by the news of this horrific act. This kind of hate and discrimination cannot be tolerated. We stand in solidarity with Muslim Canadians and with Yukon's Muslim community through this difficult time. Here in the Yukon, a number of new cases of COVID-19 have been detected this last week. There are currently 8 active cases in the territory and 1 Yukoner that has tested positive outside of the territory where they will remain until they have recovered. Dr. Hanley will have more to say about these cases in a moment, but they provide a stark reminder that we are not out of the woods yet when it comes to this pandemic. Variants of COVID-19 continue to be a concern, and they will continue to spread while we wait for vaccination rates to increase across the country. Vaccinations are not a silver bullet when it comes to COVID-19, but they do provide considerable protection. You've heard the Premier, Dr. Hanley, and I all say repeatedly that the more people that get vaccinated, the safer our territory will be. This is the truth. While getting vaccinated will not guarantee that you will not become infected, it will dramatically decrease your chances of getting seriously ill or of dying if you do become infected. It will also reduce your risk of spreading COVID-19, which will help your friends, your colleagues, and your neighbors, help them stay safe, and by extension, keep our whole community safe. Just like wearing a mask, getting vaccinated is an action that you can take as an individual to protect yourself. It also protects the health and safety of others in your community and of all Yukoners. Our immunization rates continue to be strong. More than 79% of eligible Yukoners have received their first shot. But we need to catch up when it comes to second shots. We are currently at 71%, and we need to get that number up. Remember that you are not fully vaccinated until you've received 2 shots and at least 14 days have passed since your second shot. We lifted some restrictions on May the 25th, and we will need to get our second doses up to 75% if we are going to be able to lift more restrictions. Our youth vaccine is rolling out here in the territory. The first dose clinic is open in Carmacks today, and one will be open in Dawson City tomorrow and Teslin on Friday. The clinic is also open here in Whitehorse. I strongly urge all youth and all Yukoners to step up and take your shot. We are very fortunate to be able to provide vaccines for everyone over the age of 12 that wants one. Most other places in Canada are waiting on more supply, and people have to wait for months to receive a second shot. We need to seize this great opportunity that we have to keep our community healthy and safe. Remember that Dr. Theresa Tam, Canada's Chief Public Health Officer, called the Yukon, quote, a model that we're all looking toward for success, end quote. That is high praise, but we need to take that responsibility seriously. So please go to yukon.ca/thisisOurShot to book an appointment. And if you have any questions about the vaccine, please get in touch with your doctor or local nurse to get the answers. I want to thank everyone who has already received vaccines for helping to protect our communities across the territory. I also want to thank the entire vaccine rollout team that is helping Yukoners take their shot. The vaccine saves lives, and each one of you is making a difference. I'd especially like to congratulate Yukon Aboriginal Women's Council, which was announced as a finalist this week in the Public Health Agency of Canada's Vaccine Community Innovation Challenge. The Yukon Aboriginal Women's Council is receiving $25,000 to implement their project called Protecting Yukon's Health. The project is designed to build trust in relationships with Indigenous women and gender diverse people by providing cultural reassurance about taking the COVID-19 vaccine. The trust will be built with the help of a website that showcases testimonials in traditional languages of Indigenous elders in communities across the Yukon. This is a fantastic initiative. I wish the Yukon Aboriginal Women's Council the best of luck as they now compete for the $100,000 grand prize. It is also important for us to talk about the vaccine and why it is safe to receive it and the contribution that it makes to the safety and well-being of our communities. Once you are fully vaccinated, you still need to follow the Safe 6+1, which is masking up. It also remains important to get tested if you are experiencing any symptoms related to COVID-19. You can find the list of symptoms online at yukon.ca. If you have any of these symptoms, please self-isolate and arrange to get tested, and please do not go to work. Paid sick leave is available through our rebate program for employers, including those who are self-employed. It remains vital to get tested so that we can limit the spread of COVID-19, especially when it comes to the variants of concern. And again, if you haven't already, please arrange to get your vaccine. As I said, we won't be able to continue lifting restrictions until we get our vaccine rates up higher. The one exception is what the Premier mentioned last week. Today, I'm very pleased to say that starting on June the 18th, unvaccinated children under the age of 12 who are traveling with fully vaccinated family members or caregivers will not need to self-isolate when they enter the territory. As Dr. Hanley can attest, the risk of transmission amongst this age group is quite low. I know this will be welcome news to many Yukon families who want to visit with extended family this summer and maybe introduce a new family member. The weather has finally arrived, and we are poised to have a great Yukon summer. I encourage everyone to support our local businesses this summer as they provide us all with really great service. They have been through a lot over the last 15 months, and they are ready and willing and need our support. Before I hand it over to Dr. Hanley, I know that many students have recently or are about to graduate. I want to congratulate our graduates across the territory on this great accomplishment. There is so much hard work that goes into each school year, and I know the pandemic has made that more challenging for many of our students. I commend your perseverance and resilience. You have so much to be proud of. Thank you also to all the families and educators and staff that have supported these students through another very strange school year. It takes a whole community to raise a child, and it takes dedicated communities to educate them. Congratulations to you all. Thank you very much for the opportunity to be here this morning.
Thank you, Minister McPhee. Dr. Hanley?
Thank you, Pat. Thank you, Minister McPhee. Good morning. Bonjour tout le monde. I'll start this week with a case update since our situation has changed quite dramatically compared to a week ago. A number of new cases have been announced, as the Minister refers to, since last Saturday, and I'll provide some important details. As far as the outbreak at Victoria Goldmine, we remain with just the 3 confirmed cases. Close contacts remain in isolation. The mine continues to operate. We have been working very closely between our office, the YCDC, a communicable disease team, the medic and nurse on site at Vic Gold, and the medical consultant company overseeing healthcare in the mine. In addition, we are now working with those workers who are due to leave so that those not identified as contacts can leave the mine safely and with direct instructions as to what they need to do. So what happened? To many, this situation may be a bit of a shock. First, an outbreak in a mine, and now a bunch of cases in Whitehorse and even outside Whitehorse. How could this happen in such a short time? This definitely needs exploration, and that's what we shall do, as well as consider the lessons we can learn from what we know so far to guide us on the continued path forward. Challenging as things may seem at the moment, I can tell you things would be much worse if we didn't have the numbers of people vaccinated that we have already. Let's talk a bit about the recent case activity. First, as a reminder, case 85 is a Yukon resident case who was infected and diagnosed out of the territory and will remain out of territory until non-infectious. Case 86 and 87 are 2 of 3 individuals linked to the outbreak in Victoria Goldmine. Both of these folks are Yukon residents, while the 3rd individual is an out-of-territory resident working in Yukon. We called the situation an outbreak over the weekend because we had evidence that there was transmission of COVID infection on site. Contact tracing remains underway to control and prevent possible spread throughout the mine. We're very pleased that all tests on the mine for contacts have come back negative, and we continue to work closely with the mine. In a mine with over 327 people on site, the fact that this outbreak is so far confined to 3 cases is remarkable, especially given that we have learned that these cases are due to the P1 variant. The success is for a number of reasons. First, our teams at YCDC, the crew, the COVID response unit, and our CMOH office have been working closely with all 3 quartz mines and the Iridia Medical Company that oversees healthcare for the mines over the past year and a quarter. Victoria Gold and the other 2 mines have put in place enhanced protocols, including working self-isolation, screening of workers for illness, increased sanitation, testing protocols, and close communication with YCDC in the event of any questions. This preparatory work has allowed us not only to prevent other potential introductions of COVID into the facilities, but also to quickly identify and contain this outbreak. In addition, over the last few months, we have been working to offer vaccine to all personnel working at the mine. Gradually, the vaccine uptake has climbed to levels that we estimate are around 3/4 fully vaccinated uptake, or roughly equivalent to Yukon's adult population at the moment. I would like to acknowledge the work that all the partners, including the Victoria Gold Corporation, have done to ensure that the mine staff could work in safety and that the mine could continue to operate as it is now, even with an outbreak in progress. Advanced work has certainly paid off in this case, and with no further cases identified so far. Now, as of this morning, we have 3 confirmed cases in Whitehorse, along with a further probable case in Whitehorse and probable in rural Yukon, bringing our total to 8 active cases in territory, including our out-of-territory resident at the mine site. And this brings our total confirmed case count to 90, with the 2 probable cases awaiting confirmation. Our communicable disease team is hard at work investigating the source of origin for these recent cases. We were prepared that cases would continue to be detected within the territory, and although we're only beginning to put all the pieces together, we do have the knowledge, experience, and processes in place to manage these investigations. If you have been at these locations during these times or are feeling symptomatic, please seek testing. As a quick reminder, the symptoms you should always be self-monitoring for, even if you are vaccinated, are as follows: new or worsening cough, shortness of breath or difficulty breathing, a fever, feeling feverish or a raised temperature, chills, fatigue or weakness, muscle or body aches, a new loss of smell or taste, a headache, even gastrointestinal symptoms, or just feeling very unwell. And as always, if you're unsure about your symptoms, take the self-assessment tool online or call 811 for further information. And I won't go through all the exposure notifications, but they are posted online. It's really important to have a look at those. And what's important is not just the location, but the time, so that if you were at that location but not at those times, then you don't have to worry about potential exposures. So let's reflect on what might be happening. We've identified some settings on the public exposure notice where either members of the public could have been exposed or where transmission of COVID may have occurred. One obvious question is whether there's a connection between the Victoria Gold outbreak and the cases that we're seeing now in circulation outside the mine. That's a question we all have, and we are looking for possible links, as well as an explanation for higher case counts. Now, what about the role of vaccination? With Yukoners over 70% fully vaccinated, should this be happening? I was asked this question a couple of weeks ago, and I said, the answer lies in whether the remaining 30% or so of unvaccinated adults are evenly dispersed through Yukon and throughout all sectors of society, or whether we have large groupings or communities of vaccinated people, of unvaccinated people who could spread the virus amongst them. For instance, it could be people sharing a common household or setting, or a particular age or social group. That is information we are trying to understand, but it takes a while to obtain. That is also why I have continued to plead, just as the minister said, that whatever global target we set, the more people we vaccinate, the better. The ability of COVID-19 in our present circumstances to spread relies on the answers to 3 key questions. First, is this case activity due to one or more highly transmissible variants? More than likely it is, as we have seen in the mine cases. So we will see more transmission than we might have with last year's COVID strains. Second, are there settings in which we may have had intense transmission of the virus? Are there circumstances where there were many people in one place with lack of masking and physical distancing? That is information we are looking into at the moment. And third, are there groups or high proportions of unvaccinated or partially vaccinated people in a particular setting that could facilitate transmission of the virus? These are questions that, again, we will be answering as we continue the investigation. We noted in yesterday's media release that 2 of the 6 Yukon cases were in hospital, and today I can say 3 of 7 are in hospital. That is a remarkable proportion, given the low rate of hospitalization that we have witnessed over the previous 80+ cases. We're all wishing well to these individuals and know that they are being well cared for. It is important to note that these individuals are younger than one might expect. 2 are between ages 40 and 50, 1 in their 60s. These examples remind us that this is not a benign disease. It is also worth noting that our 3 patients in hospital are not vaccinated. Of the 4 cases not in the mine site, none is vaccinated. I know there have been many questions about the individuals at the mine and their vaccine status, so let's talk a little bit about how vaccine protects against infection and how breakthrough infections can occur. Infections in fully vaccinated people are rare, but they do occur. And they will occur more easily when conditions favor transmission. That is why reducing the chances of exposure is still important, even for people who are fully vaccinated. In the words of one eminent epidemiologist, if you're wearing a flame-proof suit, does that mean you can walk into the fire? Not something that most experts would advise. When someone is very infectious, and if the setting is perhaps indoors, close, and not well ventilated, then infection will occur more easily. But still, for COVID-19 and for most of the variants we know so far, your chances of infection are vastly reduced. And even when infection occurs, your chances of getting severe disease or of passing it on to others is considerably lower. So vaccination works even with variants and remains our key to ending this pandemic. We've always said we will continue to have cases, even clusters or outbreaks, from time to time, and we are in a place where we can begin to normalize COVID-19, a place where we are prudent but not fearful. Perhaps as we work through this pandemic, we will learn to get used to living with this virus. It is clear, given ongoing low testing numbers and at times lack of attention to safe 6 measures, that we have become quite comfortable, and to use a common pandemic word, complacent in recent weeks. It has probably felt, with no active cases for several weeks up to now, that we have a security blanket around us. Getting ready for loosening restrictions means we have to observe whatever measures are in place at the time. For the moment, that means observing the Safe 6, the gathering limits, and rules and regulations that apply to workplaces, recreational facilities, bars, and restaurants. As we work through this outbreak and get back to low activity, and as we continue to increase our percentage uptake of vaccine, we can then renew our path forward and look at next steps in loosening restrictions. We must get to 75% second dose uptake as a minimum. As I said, the higher the vaccine uptake, the more secure we will be. 80% plus first dose and then second dose. Ages 12 up would be ideal, though our first threshold to reach is that 75% second dose mark. Meanwhile, when symptoms occur, it is so important to remember that what feels like the flu or a cold could be COVID. When you're sick, whether it's a headache or you just run down, it's better to get a test than disregard and possibly spread the virus to those who may be unvaccinated and more vulnerable than those who are vaccinated. We must keep testing as we work towards the new way of living with COVID. We've shown that even vaccinated people can get infection. But especially if you are vaccinated, unvaccinated, or have had only 1 dose, testing is important to identify disease that otherwise could get away from us before we know it's there. Now, as Minister McPhee indicated, some changes will be made to the current self-isolation guidance for children under the age of 12. I know for many of you who have begun planning your summer vacations and trips to get a little more sun or to see family in person rather than on FaceTime, for those with children under the age of 12, it has been a bit more difficult to plan those adventures and trips. So as the Premier and I first mentioned last week, we have been exploring the recommendation that children under 12 should not have to self-isolate if they are traveling with a parent or caregiver who is fully vaccinated. And this change, as the minister announced, comes into effect on June 18th. While children under the age of 12 are still unable to get vaccinated, our modeling team took a look at the data on children in this age group related to COVID-19. We determined that given the continued decline of case activity in Canada, that the risk of a child in these circumstances acquiring infection is very, very low. Even with variants around, children do better than adults with COVID, and their role in passing on the disease is lower, especially in a population with low COVID activity and high vaccine uptake. I'm therefore very comfortable with this recommendation. I hope this allows parents to breathe a sigh of relief and possibly provides a bit of an extra incentive, if you still need one, for those unsure whether to get vaccinated. I know how important travel is to many who live in Yukon, and to no longer exclude those who have young ones is a gift that we could give Yukoners as summer vacation quickly approaches. When the time is right, it will also allow friends and family from away with young children to visit our beautiful territory and enjoy a Yukon summer along with us, as this will apply to both Yukoners and people traveling here from other parts of Canada. Before rushing to book flights, let me remind you that overall in Canada, non-essential travel is still not advised. We are, however, heading in that direction as the current waves start to crest or decline. Please, though, do your research and find out what you can and cannot do while in a different jurisdiction. Please be courteous when traveling, whether you're roaming in Yukon or out of territory. Rules and restrictions may be different, and we need to graciously respect them when we are traveling somewhere else. Once you return to Yukon, you will be required to follow the current process in place. And again, if you or your child is presenting symptoms following your trip, seek testing. I do hope the sharing of this news will decrease the complexities of trying to plan a trip back home to see your family or friends if you're from out of territory. As of June 18th, we will have further guidance available for traveling with children under the age of 12. Donc c'est tout pour aujourd'hui. Please take care of each other. Remember to be grateful for what we have. Stay well. Merci. Thank you. Shonethan Masicho.
Thank you. We will now go to the phone lines, and we'll begin with Steve from CBC.
Hi, this question is for Dr. Hanley. I know you said that you're exploring what happened, like in regards to how these cases came to be, but can you go into what you and or the Yukon government knows or suspects in regards to the origins of these most recent 8 cases in Yukon, please? Like, how did those infections come into the territory? And including the rural case, can you name which community has that case? And is it related to the mine or Whitehorse cases, please?
Yeah, thanks for the question. So, on the latter point, as you know, we don't announce rural cases as to location unless there's a public exposure notification. As these cases have just come to our attention since the end of the day yesterday, we don't as yet have a further indication of a need for public exposure. So more to come. You're asking good questions, and as I said, those are the same questions we have, and we don't have the answers yet. Of course, we would very much like to know the source of the infection to Yukon, to the mine. How did it enter the mine? Because and why is that important? It's important because it may help to identify any other transmission or cases in the mine that would not otherwise have been identified through the initial contact tracing. The second thing is whether the cases that we're seeing, as I said, outside the mine, are related. Is there one introduction that has led to all of these cases? And I don't know the answer to that. I mean, we do know that in other mine outbreaks outside of Yukon, there have at times been multiple introductions. So I think this could go either way. This could be different introductions of infection causing different outbreaks, or it could be all part of one outbreak. So clearly that's information we're interested in, and I don't yet know the answer to that, but we're continuing to do that what we call backward tracing, or that ongoing investigation. And sometimes a new case comes up that helps us to link. Yeah, we're working on the answers to that.
Thank you. Do you have another question, Steve?
Yeah, I do. I know you said that you were looking at the modeling there, and that's one of the ways you determined that it's safe to allow unvaccinated kids to travel, I guess, more freely without having to self-isolate and all that jazz. Can you further explain how that is a good thing to do right now? I'm trying to think of what kids under 12 do. They go to school. I guess that's wrapping up soon, but they'll be going to summer camps, and who are their peers? Other unvaccinated kids, right? Because kids under 12 can't get the vaccine. So how is this safe, especially considering, you saw the issues with the outbreak in Yellowknife recently with that outbreak that forced schools to close even?
Yeah. So again, we look at the risks and we do some risk calculations, and then we look at what are the, is this a risk that we should take on because of other advantages or consequences, such as the ability of a family to stay together while they travel, and not have to have encumbrances upon them when they return to territory associated with self-isolation. So it's really looking at, is this pragmatic? Does it make sense given any additional risk that this might take on? But as I say, some of it will lie in the details, because we expect that this is travel kind of that these kids are nested within that vaccinated caregiver family. So if there are other exposures, if the kids are being dropped off and going to a camp where there's a potential for exposure, then that doesn't count, let's say. So it really is to make sure that there are appropriate measures to reduce exposure opportunities, you might say, for kids as they travel with fully vaccinated parents. If they're handed off to someone who is not vaccinated, again, that doesn't count. So I think there are some conditions on how this will occur that will come with the guidelines. But it's all under that sort of context of exposure reduction. And the typical case might be someone traveling with a baby and a 5-year-old. Or kids that are going to be staying at a cabin somewhere, so with the family. So providing those opportunities for family travel and visits, but in a kind of a safe way. And I think it's also relates to, anyone fully vaccinated, if you're going out for a few days for an adventure holiday or an urban dining experience or whatever, exposure reduction, meaning being sensible about where you go, is really an important part of that travel, at least for the time being. So the risk calculations that we do, that when you model the potential for exposure given the declining rates of infection across the country, end up being minuscule and almost negligible for kids to acquire infection, as long as it's done in the right way.
Thank you. We'll move now to Tim, Whitehorse Star.
Yes, good morning. First question is, I noticed on social media over the weekend there were more than a dozen comments to a post asking if there was some kind of flu going around Whitehorse. Just wondering if the numbers at the hospital or doctors' offices are reflecting anything like that going on?
No, not based on our surveillance data, but that's really good. I mean, that's really good to hear. And I'm hoping that anytime, on that anecdotal information, because we have heard, I would say, although not through healthcare provider offices, but through again, other channels like that, anecdotally, of people with bad colds. Even though it does not appear that absenteeism rates at schools have gone up significantly, we are hearing similar stories. So I'm hoping that the question that people ask is, okay, again, could this be something else? And if the symptoms are there, that people think about getting tested. And that again, that's our way to detect these signals of otherwise undetected infection in the community.
Next question, Tim.
All right. I just wanted to ask briefly to you about the 3 people in hospital here. How severe or is their condition? Are any of them on a respirator?
So I'm being a little careful about, again, delving into individuals. I would say that the 3 hospitalized cases are stable, and I don't have up-to-date information as of today, but I do not, certainly as of yesterday, there was no indication of anyone being at that level of severity.
Thank you. We'll move now to Haley, Yukon News.
Thank you. My first question, Dr. Hanley, you had identified that the 3 people in hospital weren't vaccinated, as well as the cases at the mine were unvaccinated people. I'm wondering, any of the cases that have been identified so far this past week, are any of them vaccinated people?
Yeah, just to be clear, there was, I think it was the president, Mr. McConnell, who talked about vaccinated people at the mine site having infection, and that is true, that there were 2 partially vaccinated and 1 fully vaccinated who did have infection there. So that stands as is. So and that's why I really wanted to talk about that. You know, under what circumstances can people with vaccine get infection? And there is much higher. There are much higher breakthrough rates with 1 dose of vaccine than with 2 doses, of course. And it's that 2 doses plus 2 weeks that is fully vaccinated. But even someone fully vaccinated, if they're exposed to a lot of infection, or if they're exposed in high transmission circumstances, we can see those cases. What is the good part of that is that these people almost never get into trouble in terms of serious disease or hospitalization. That's what the big data has shown us from some of the real world studies in the UK and Israel and in the US. So, and even now here, some of the Canadian studies coming in which validate that. So the protective rate of 2 doses of vaccine is extraordinarily high, but people can still get infection under those more intense transmission circumstances.
Next question, Haley.
Thank you. My other question, it's just a bit of a clarification, so I apologize for the repetition, but I wanted to make sure, is there a case 89 and 90, or are those the probable cases in Whitehorse? I just want to make sure I have the right number, just keeping track of all these cases.
Yeah, and it is a bit of a challenge because we've had a flurry since yesterday. So, but we have 90 is confirmed. So generally, when we publish a number, that means a confirmed case, and so there are 2 further probable cases that we will expect confirmation on.
Thank you. We'll move now to Vincent, Radio-Canada.
Oui, bonjour Madame la Ministre, bonjour Dr. Hanley. Ma première question, c'est en français s'il vous plaît. Est-ce que ces nouveaux cas, c'est un peu un test pour l'immunité collective? Est-ce que vous pouvez nous expliquer pourquoi?
So, Dr. Hanley, can we see these new cases as a test case of vaccination? And if so, why would it be the case?
J'ai pas tout à fait compris la question. Est-ce que vous pouvez expliquer un peu plus?
Oui, bien sûr. Le fait qu'on voit, après 1 mois sans cas, on voit des nouveaux cas arriver, et je voulais savoir en quoi c'était un test pour le principe de l'immunité collective, maintenant qu'on a atteint 79% de première dose et 71% de deuxième dose.
So basically, are the new cases that we're seeing right now some kind of a test of the collective immunity that we were trying to achieve with the vaccination campaign?
C'est une très bonne question. Et oui, je pense que c'est une sorte de test pour la capacité de voir transmission d'infection dans le territoire. Et donc, dans les prochains jours, je pense, on va comprendre beaucoup plus de la protection qu'on a avec la taux de vaccination qu'on a dans Yukon. Et si on a plus de susceptibilité ou plus de vulnérabilité, est-ce qu'il y a des poches des gens qui sont sous-vaccinés ou non vaccinés? Par exemple, les groupes sociaux, les locales géographiques, ou certains secteurs de société. Et donc, est-ce qu'il y a quand même des poches significatives où on peut voir des éclosions? Et donc, je pense que c'est en partie, oui, c'est un test pour voir avec. J'imagine que ce sera un variant qu'on va voir. Et ça sera très intéressant à voir l'effet que la protection qu'on a. Je pense que s'il y avait 6 mois avant, on sera déjà dans une situation de voir beaucoup plus de cas. Mais je pense que la preuve va venir dans les prochains jours.
Thank you. Une autre question, Vincent?
Oui, merci. Je voulais juste savoir, avec ce nombre de cas qui augmente, dans quelle mesure, quelle est la limite que vous vous fixez pour peut-être voir changer les restrictions qui viennent d'être allégées?
So, given these new cases, have you set a new limit of what could happen given that we have removed some of the restrictions that we had done in the past?
Donc, ça veut dire si on va régresser dans les restrictions ou faire plus de restrictions, c'est ça la question?
Oui, c'est ça, merci.
OK. Donc, oui, on a toujours essayé de faire les mouvements des ouvertures avec solidité. Donc, même si on voit des cas, même si on voit des éclosions, on est assez stable qu'on peut continuer avec le même trajet, on peut dire, ou les mêmes mesures. Ce que ça peut changer, c'est le futur. Donc, il faut au moins connaître les limites de cette éclosion ou ces cas avant de contempler les prochaines étapes. Et ça va nous donner aussi l'opportunité pour avoir plus de vaccinations. Donc, c'est plus une opportunité pour voir, pour rester stable où on est et pour mesurer le bon moment pour faire les prochaines étapes que d'aller en reverse. Je pense que ça sera peu probable. Ça va prendre beaucoup plus qu'on a maintenant pour aller en revers, pour faire plus de restrictions qu'on a à ce moment.
Merci. On va maintenant passer à Marine, l'aurore boréale.
Merci. Pardon. Donc, on était initialement sur un objectif de 75% de la population qui aurait les 2 doses de vaccin. J'entends Dr Hanley qui dit qu'on essaye toujours d'avoir de plus en plus de personnes vaccinées. Est-ce que cet objectif de 75% a été augmenté? Est-ce qu'on a un nouveau seuil pour cet objectif-là, sachant que certaines personnes ne peuvent pas être vaccinées pour différentes raisons, notamment médicales. Donc, est-ce qu'on a un nouvel objectif?
So originally, you had the objective of vaccinated the 75% of the population with 2 doses to achieve collective immunity. Given that some people cannot receive the vaccine, are you changing this objective, trying to increase it in terms of how many people would be vaccinated with 2 doses?
C'est important de faire peut-être une distinction entre immunité collective et la seuil ou le cible qu'on a prévu. Le cible qu'on a prévu de 75% deuxième dose, c'est resté sur l'estimation de réception de vaccins. Et on a dit que plus ou moins, ça probablement correspond avec une immunité collective, mais on sait toujours, on savait que c'était pas sûr, parce que avec les variants, avec l'expertise qu'on a vue, ça peut être beaucoup plus, ça peut être jusqu'au 90%, par exemple. Donc le cible, c'est effectivement le mieux. Le plus qu'on a vacciné, le plus confiant le plus confiance on peut avoir pour aller en avance. Et donc le minimum, c'est ce qu'on a prévu, c'est le 75, deuxième dose. Mais je pense qu'on reste plus sûr avec plus. Et si on peut atteindre 80 et plus, deuxième dose, je pense qu'on va rester plus sûr et avec moins de possibilités des cas et des éclosions.
Merci. Avez-vous une autre question, Marine?
Oui, merci. Merci, Dr. Hanley, d'avoir précisé la différence. Ma question était effectivement sur les cibles et non pas sur l'immunité collective. Par contre, donc ma deuxième question serait, est-ce qu'il est prévu de vacciner les enfants en dessous de 12 ans pendant l'été ou au moins d'ici la rentrée scolaire?
Are we planning to vaccinate children less than 12 years old before the start of the school year?
Tout ça dépend sur quand ce sera permis selon Santé Canada. Et l'application n'est pas encore venue et je pense que ça va probablement prendre quelques semaines au moins jusqu'où les études sont complètes pour Moderna et Pfizer pour soumettre leur application. Donc, je pense qu'on a plusieurs semaines avant même la régulation de ces vaccins. Donc, je pense qu'on va commencer l'école sans cette opportunité et cette opportunité va probablement arriver plus tard. Je veux dire que c'est pas une condition de revenir dans les écoles. C'est une étape additionnelle, mais on anticipe qu'on peut rentrer aux classes avec toute sécurité, même si on n'a pas encore les vaccins disponibles pour les jeunes.
May I ask you to repeat that in English, since it was for children under 12?
Sure. The question, just to be clear, was about are there plans to vaccinate the young children under 12 before the school year? And I said, no, we don't have plans in place. The vaccine, the Moderna and Pfizer vaccines are not yet regulated for that age group. In fact, the studies are not yet completed and the submissions have not been made, and that we may be several weeks away even from the end of the studies and the submissions to Health Canada for regulation. So it's not possible. I doubt that we would be actually able to commence vaccination in the short time before return of school. And I also do not think that that's a necessary step. I think when it's available, that will be great. It will be welcome. and it will be an additional step of safety and security for our kids. But our kids can go back to school with full confidence, and we're of course working with the department to make this happen on schedule in late August.
Thank you. We'll move now to Nick, Canadian Press.
Hi, thank you for taking my question. Dr. Hanley, this is something that we're just starting to, that health officials in BC are just starting to talk about, but I'm curious if you can share your thoughts on, I guess, what happens next with COVID. Do you see people having to take booster shots, like yearly booster shots, like flu shots? And just, do you think this, like, COVID cases will become like a reoccurring kind of yearly issue, if that makes sense? Thank you.
Yeah, thanks. I think there's still much to learn, and I think it's clear that the challenge of global vaccination is huge and will take potentially years to accomplish. And meanwhile, we will be in a situation where we will likely be seeing new variants and new episodes. So for sure, this disease is not going away. It's even hard to predict the end to the pandemic. We are definitely again, well positioned for future openings and the ability to live our lives close to normal, but definitely COVID will become part of our lives. And yes, I anticipate that we will be looking at repeat vaccinations and potentially even something like the flu vaccine, where there's a new formulation every year based on what's circulating. So yeah, that's really only what we think at the moment, and that will, certainly over the next few months. First, we'll know more about how long this present vaccine lasts, and we know more every week about how different variants respond to the different vaccine products. And we have new vaccines in the pipeline as well, which may have different characteristics, including one Canadian product, the Medicago vaccine, anticipated for fall and beyond. So I think, yeah, lots to know and learn, especially as new variants come on the scene and new vaccines as well, and new studies and durability of vaccines. So great question, and we don't really know yet, but yeah, it's going to be around.
Do you have a second question, Nick?
No, that's it for me. Thank you.
Thank you. And we'll move to John with CKRW.
It has been in the media recently that the federal government is considering relaxing some of the international border restrictions to fully vaccinated Canadians, namely with our close neighbor, the U.S. So I was wondering, Dr. Hanley, do you have any information or advice on how that may proceed for Yukoners who might be eager to get out to Alaska? Have you been briefed on any of this from some of your counterparts on a national scale?
Yeah, I will say it really is early, and yes, those conversations are definitely beginning to happen. There's of course a great interest in how this might happen. We know, of course, people want to travel. There are families that are separated between the U.S. and Canada, as well as, of course, as internationally. So there is talk of a phased-in approach where, for example, fully vaccinated Canadians or people traveling into Canada would be able to forego self-isolation, and that there may be those kind of steps. So, yeah, I think this is early, but I think through the summer we'll probably see these conversations rapidly accelerate. That's about all I can say, because we don't really have the specifics yet, or even timelines around that.
Minister McPhee.
Thank you very much, and thanks for the question. The conversation is ongoing, of course, between governments and across the country and with the federal government. They will ultimately take into account the advice of the medical officers of health from across the country, and the conversations are happening at both of those tables, but we await some more advice from the the medical profession and the public health experts, but the conversations are ongoing and will be informed by that advice from medical professionals. And the conversations are happening, of course, throughout Canada about moving around and ultimately with the Americans and our long border here in Canada.
Thank you. John, do you have another question?
No, I'm okay. Thank you.
I'd like to thank everyone for their time today. The next update will take place on Wednesday, June 16th at 10:30 a.m.